So we've known that for a long time, that hypomania, mild manic states, change the way people experience the world around them. And we also know that, for example, it's been observed for hundreds of years that when people become manic, they become interested in things that they often were never interested in before. Poetry, they begin rhyming, spontaneously rhyming. Anybody who has treated anyone who has manic depressive illness will know that when people are manic, you will get manuscripts, reams and reams of manuscripts of people frequently in all different colors, exclamation points, underlining, sense of time urgency, and so forth. People become much more generative when they're hypomanic, mildly manic. There are all sorts of things that go into being creative. Some of it's being just flat out smart, some of it's being original, but some of it is also temperament and perseverance and being able to go on, persevere in the face of criticism. There is another side to the productivity and creativity that comes from bipolar illness, and it comes from depression. I don't think anybody who knows depression would say that people are very creative when they're depressed. They're not. It just doesn't work that way. But very often people can draw upon what they have been through when they have been depressed. And I always tell patients that, look, it's horrible now, it's terrible, but when you get to the other side, you will be able to use this and utilize this and incorporate it into some philosophy and way of going through life. And I think it very often puts into perspective work that is generated in more fevered states. People very often generate a great deal when they're manic, and a lot of it's terrible. And what you want is to be able to prune that. And actually depression, because it's so critical, is often very good at doing that. People also will say, as indeed people who've had cancer or been through any terrible experience in life, that increases sensitivity and compassion, gives them a broader view of humanity and a tendency to look inward and to ask why. There are a lot of psychological studies that indicate also that people are actually just much more realistic when they're depressed than when they're normal. Kind of a frightening thought. So there's less denial. People look at death, the transitory nature of life, much more realistically when they're depressed. And people, if they're able to transform, if you have the ability, if you're fundamentally a creative person, and you have that capacity to generate something out of a terrible experience, then the transformation of pain into something that is more universal can be something that is genuinely creative. So I'm just going to end on the implications of this. This is a New Yorker cartoon, needless to say. And it addresses the issue that I think that anyone, again, who practices, when I was at UCLA before I went to Hopkins, a great deal of my practice was with artists and writers. And artists and writers will come in and say, that they are very frightened of losing their creativity and their originality if they're going to be medicated. That this is an angel's gift, they don't want their wings clipped and so forth. It is a completely legitimate issue. The medications that we have are difficult to tolerate. Anybody that's been on these medications will know that. There's nothing easy about taking any of the medications. And the medications are developed to work on the central nervous system. They're developed to work on energy, mood, motivation, and so forth. So it's not surprising that artists and writers are concerned. So the issue is, what do you do with that? I mean, if you're a clinician and your job is to try and keep people alive first and foremost, and then to make a meaningful life for someone whose creativity is at the core of their notion of themselves, how do you do that? And the answer is it's hard. But like with any patient, you have an obligation, a moral and legal obligation, to say to a patient, what are the risks of the treatment, and what are the risks of no treatment? Now, what artists and writers do, of course, is focus upon the risks of treatment. What's the medication going to do to me? The job of the clinician is to pay attention to that, listen to that, but also to point out the risks of no treatment. So I'm just going to go over these very briefly. And And there are risks of treatment. I mean, one of the things that if you have a medication that works well, one of the ways it works is by eliminating or moderating the elevated states. So patients who are used to having periodic hypomanias don't like having those hypomanias taken away. It's very hard to tell somebody who's feeling better than he or she has ever felt in his life that they're sick. You lose your credibility. People just don't believe it. They feel terrific. So that is the job, is to really be convinced yourself from knowing the literature and the biology of this illness and the natural course of this illness and the risks of this illness, is to be able to convince people based on what you know that the risks of no treatment are very significant. So the risks of no treatment are suicide, a major risk. And you know, I often point out to people that nobody's very creative 6 feet under. Likewise, nobody's very creative in 4-point restraints or on a hospital ward. You don't see a lot of people creating magnificent pieces of art on the wards. Occasionally, but rarely. Likewise, people really need to be informed that the illness does tend to worsen over time. It doesn't go away, and it does become more frequent, and it does become more severe. There's also this tendency to romanticize other drugs and to kind of demonize psychiatric drugs and to romanticize cocaine and alcohol and enormous quantities of caffeine and smoking. And of course, these are all far more problematic treatments than the prescribed treatments. And I just want to leave with the issue of suicide, that we actually have a drug where there are more than 35, this is actually an old study, old summary here, but there are more than 35 studies now showing that lithium has a profound effect on suicide rates. That more than 5-fold decrease in death from suicide on lithium, and quite specific to lithium. So that, you know, when you have an illness that has a very high suicide rate, and then as I say, it's not just a high suicide rate, it's also a high rate of cardiovascular death. And when you study people who are on lithium, what you find is that their dementia rates, for example, Alzheimer's and other dementias, go to the population rate instead of being much higher. If you're untreated and you have bipolar illness, your dementia rate is way up there. Your cardiovascular disease rate goes to the population rate. And one of the great things, one of the scientific advisory board members, Dr. Husseini Manji, has shown, and other scientists have shown, is that actually lithium generates parts of the brain that are very important in memory and so forth. So these are drugs that not only don't necessarily do bad things for your brain, they do very good things for your brain. But I can tell you that the number of psychiatrists out in the community who know those facts is not very many. So if you're trying to make a persuasive case to people about medications, you need to kind of know the literature. Likewise, it turns out that actually most people who are on lithium or on other psychiatric medications don't experience cognitive or other major side effects, or not significantly so. And the two studies have actually asked artists and writers, do you feel as productive, less productive, or more productive on medication? Have found that 3/4 of the artists and writers said that they are as productive or more productive on medication than they were before taking it. So I just want to end with the person I began with, just because Robert Lowell, more than any other artist or writer, has certainly had an effect on me in terms of personal inspiration when I was devastated in high school and through the years. And this is something that Robert Lowell said. Robert Lowell, for the first time when he went on lithium, when it became available to him, for the first time in 20 years did not have a manic episode. Of all our conversations, I remember, this was his publisher speaking, I remember most vividly Robert Lowell's words about the new drug lithium carbonate, which had had such good results and gave him reason to believe he was cured. It's terrible, Bob, to think that all I've suffered and all the suffering I've caused might have arisen from the lack of a little salt in my brain. Thank you.